Good afternoon, and welcome to the Indiana Rural Health Association's Indiana Rural Opioid Consortium, or Inroc's, International Overdose Awareness Day programming on YouTube. We're pleased to be joining you today live from Indianapolis to share three heartfelt stories about addiction and what they have meant to various different individuals throughout our state. Joining me today is Dr. Amnah Anwar, who is the program director of the Inroc Consortium, and she has a few remarks to open up our day.
Indiana Rural Opioid Consortium is a grant-funded program where we're working in rural Indiana to overcome the opioid and substance use disorder epidemic. We are working with clinical partners and community stakeholders to bring awareness, outreach, fighting against stigma, as well as increasing the access to treatment to substance use disorder, hepatitis C, and HIV.
So throughout today, we have three stories that we're pleased to share, and we thank those who share their stories with us and allowing them to be broadcast. We have several staff here in Indianapolis with us, helping to monitor our chat window on YouTube, so please feel free to type in questions after each story. We'll have the opportunity to answer those questions, have a discussion with Dr. Anwar as well. You'll also see throughout at the end of each video, and we'll show a slide a couple times, there is a link that if you have a question that you do not want to ask publicly, but you still have a question about opioid misuse, addiction, or anything else, please feel free to go to that link. You're going to be able to type in your question, and that question will be sent into our team to be able to answer you privately, and you'll have the option to decide how you like us to respond, either via text message, via phone call, or via an email. But please, if you have a question that you're willing to share, please put that into the chat window for us to share. So now we're going to launch into our first story today, being shared by Katrina Norris. One of the most tragic facts of substance use disorder is that it affects the entire family. And one of the most unimaginable traumas we can imagine as parents is watching our own children struggle with addiction. However, many of us may not consider the ripple effect experienced by grandparents and grandchildren. Katrina Norris' story is unfortunately all too common across the United States, as so many grandparents are thrust back into the role of primary caregiver while their own child is actively using, all while trying to navigate the complex web of the child welfare system. So sit back and enjoy this story being shared by Katrina Norris, and we'll rejoin at the end for a brief discussion.
Psychiatric Hospital Network, and I am honored to be here today to talk to you about addiction, the family disease. So the American Medical Association and the American Society for Addiction Medicine have varying definitions of what addiction is or what it is not. And I really prefer the ASAM definition because it recognizes the brain chemistry and how the brain chemistry is changed and the addicted brain. I call that the hijacked brain most of the time. So wanted to share those with you and just really tell you about my story and how I got here, because addiction is a complex, chronic, treatable disease. We know that. We have all the research. We have MAT. We have multiple courses of treatment for addiction. What we often fail to recognize, or what we fail to talk about, is that addiction is a family disease. It's far more complex than just the person suffering with substance use disorder. So when I say it's the family disease, I say that because it impairs severe dysfunction in a family unit. And I could give you a million examples of how, when you have a loved one who is suffering with substance use disorder, how you cope with that person and how you cope with your other family members because of that person, how you interact with each other, it changes drastically once the person that you love has a substance use disorder. You love your child. You hate the disease. And that, I think, is what makes this so complex. So I'm going to share with you a little bit about my story and how we got here. Caitlin is my daughter, and Caitlin was a honor student. She was an athlete. She graduated high school midterm. She was sassy and very had the fire, I guess, of what you want from a strong, independent woman. And I thought, this is going to be okay, even though she was a little sassy. It was, we had our days, like most parents do with adolescents. At 19, Caitlin had a child, and I wasn't exactly thrilled to become a grandma at 39. So that was not exactly where I wanted to be, but life happens. You take your blessings as they come. And she had a C-section. So when she left the hospital, she left with 90 Percocets for a C-section. And I didn't really think about it in that sense of, boy, that's a lot of opioids to leave. I've never had a C-section. Who am I to judge? And someone's prescribing practices, loved her OB doc, trusted him. And that's where our journey began with prescription opioids, which most families can obviously relate to, that we've seen this epidemic unfold based on prescription drugs. Within 6 months, we were into IV heroin use. So it didn't take long for her brain to change, and that wasn't enough. That prescription medication no longer fulfilled the craving in the brain. I mean, it was a very short window of time. So, like I said, things got worse, and very rapidly got worse, in the sense that from taking prescription drugs that were given to me by a doctor, so they're safe, and that myth, to IV street-level heroin. You don't know what's in it. My granddaughter was born, and by the time she was 18 months old, I had guardianship of her. So how we got to that place was multiple overdoses, multiple arrests, multiple failed treatment attempts, and ultimately my child had become homeless. And not homeless and living under the bridge with the paper sack stigma, but homeless and couch surfing. Not that she couldn't come home, that was always on the table. You can always come home. But there were rules at home. And in addiction, they don't like the rules. The rules don't work for them in getting their needs met and their cravings. So what ended up happening was drug dealing. Drug dealing happened because that was a means to support this habit that now was a necessity. And I think that is what most families don't know, is when you're addicted to opioids, you just want to be well. And it's no longer about getting high. It's about staying well. It's about not being sick. And so she was chasing wellness by her definition, because I knew the clinical manifestations. I knew the things that were happening in her brain, and it put me in a very awkward position where she would talk to people and they'd say, your mom saved my life, and I couldn't save hers. So you can see how complex this got for someone who knows it and knows this disease in and out and how to treat it, but I couldn't get her what she needed. And ultimately, one of the biggest days of my career, I'm going to ribbon cutting to open a treatment facility, excited, on a project I'd worked years on, and I'm driving with my best dress hung up in the back seat and my heels, and I'm so excited. We're going to cut the ribbon. We're going to open North Star Recovery Center, and the radio clicks on, and it is our local news, local radio station, and I hear Jeff Lane's voice come across the airwaves, and my daughter's been arrested for dealing heroin. And she's posted bond within 6 hours of arrest. So I'm like, oh my gosh, I gotta go open this facility. I've got all these people waiting. We've planned months for it. What am I gonna do? And I've gotta get on stage and I've gotta talk about this and how we're gonna save people. And my kid just got arrested. So it was, again, that internal tug of war. What do? You're gonna stain my day. And that's how you feel as a parent, as this was my day that I'd poured my heart and soul into for years. And again, the disease of addiction had put a strain on that. So the emotions that families feel and that they experience is like a roller coaster. You love them, they're your child, and you remember the sweet, innocent little girl, or you remember going to softball games and all of these other pieces of childhood memories, and then they've wrecked my plans for the day, and now I've got to compartmentalize my feelings, and I've got to go on stage, and I've got deliverables to do, because that's my job, and hold it together. And I remember that day so vividly, because I come off stage, my CEO is coming in to check on me, and he was like, man, you knocked it out of the park, way to go, way to go. And when I turned around, I was just flooded in tears, and he was like, what is wrong? And I have to stand there and tell my boss they've arrested my kid, and I know the prison sentence that it carries, but yet I know she has to be accountable for breaking the law. So you're just constantly in this mixed emotion state. And if you're in a professional position, or any position for that matter, as a family member, you still have to survive. So you still got to go to work. You still got to do your job. And it is absolutely insanity, as much for the person suffering from the disease as the family that's coping with it. One of the emotions that most families experience, and they sometimes don't know it, is enabling. And that enabling comes from parental guilt. You go back in your head and you think of everything you've ever done wrong, like parenting comes with, a guide or something. Here's how you raise perfect kids. Every kid is different, but you really beat yourself up, and you think about, did I miss a red flag? Should I have put her in this extracurricular activity? Should we have attended more church services? Where did I go wrong? How did I do this and end up with a person suffering from substance use disorder that I love so much, that had so much potential? And families will start to make excuses for behaviors. They will give the person money. They'll blame other people. Oh, and I'm as guilty as anybody for that. And I knew better. I was a trained professional, and I knew better. But I did make excuses for her behavior. I did blame people for her behavior. It was the crowd she was running with. It was the person she was dating. And that's all enabling behavior. There's also more. There's more. It's more complex. There's more emotions. There's anger, there's resentment, there's hurt. And for Caitlin and her situation, I already had her daughter. I had guardianship of her daughter and was caring for her daughter, who had lots of questions. And you don't want to have conversations with, a 2 or 3 year old about substance use disorder. She came up pregnant again. And so you talk about mad, you talk about anger and hurt, and how could you do this again? You already have one that I'm raising, and now you have another. And I was adamant. I was not getting involved. I was not taking this baby. She was not putting me through this again. And I held strong for a long time until I was teaching a class at the IU East campus, and my phone rang, and it was Read Health, and I answered, stepped outside my classroom and took it, and they said, we're care flighting your grandson to Methodist. And I was like, my what? Your grandson. He was just born. And I was like, oh, it's too early. That's premature. He's in respiratory distress. That's all I can tell you. My daughter was incarcerated when he was born. So nobody would give me any information because she was an offender. They have policies they have to follow. I didn't know his name. I didn't know where he was going. I didn't know Riley had a NICU inside of Methodist. I didn't know anything. All I knew is if you're care flighting in February, something's seriously wrong. So that was a Thursday when he was born. I finally tracked him down on Saturday. And I'm still adamant I was not getting involved. And because she was incarcerated when he was born, DCS was obviously called. And they called me, why don't you take him? You got the other one. I was not prepared at all for him. But as soon as I got to the NICU and I saw him, that emotion come in. And even though I had resentment and I had hurt, I was like, okay, I can't let a kid go to the system. This is my blood. He's my blood. And he's super cute too, so that helps. It's kind of hard, and I held him that first time, and he had no skin-to-skin contact. Remember, she was an offender. She was handcuffed to the bed. So he had no skin-to-skin contact, and they had his breathing under control, etc., which was good. And the first thing I said is, what's in his system? And they said, well, the records we received, his UDS was clean. I said, there's no way. She was only in jail 2 days before he was born. So when she went to jail, she went into withdrawal, which then led to premature birth, kicked her into labor is what it did. And I was like, there's no way. That's not possible. You can't clean your system in 2 days. And one of the nurses behind me was speaking to a colleague, and the term junkie was in their conversation. And I don't know if that was about my grandson. Trick baby was said when I was sitting in that NICU. I don't know if that was about my grandson, but I remember sitting there holding him and hearing those words and going, words matter. Stigma hurts families, because that's a human life to me. It doesn't matter how he was conceived, how he came into the world, etc. That stigma and the things that people hear, they stick with you. So they're telling me he's fine, and they want a discharge plan, and we're working on, getting everything set up. And talk about a scramble. Go ahead and set a nursery up in 24 hours or so, and work full time and have another child at my age. It's painful. Hour 96, Camden, my grandson, started to display the symptoms of neonatal abstinence syndrome, or NAS. So it took him 96 hours to start to show those symptoms. So of course, you look at the stats, and they say, well, 7 of every 1,000 babies are diagnosed with NAS. And that doesn't sound too bad, 7 of 1,000, until you put it in perspective, which is every 19 minutes in our country, according to the CDC, babies are being born with NAS. And it is something like I've never experienced in my life. I can remember the social worker saying, oh, it's like colic, but a little bit worse. And I was like, okay, colicky babies, we know what to do with babies, and I'm a mom, and we hug them and we kiss them and we love them. Not in my brain going, you couldn't love addiction out of your daughter. Love didn't save her, because God knows I had enough love to save her. And it didn't. So 13 days in the NICU, morphine process of weaning my grandson before he could come home. And when I brought him home, I'm thinking colic. It's going to be like colic. That's what they told me. That was that was putting it mildly. So he was a baby like I'd never seen before. And so when I would think about how widely varied the symptoms are, the manifestations are, I lived it. You couldn't feed him, you couldn't bathe him, you couldn't change his diaper without him screaming. This just high pitch doesn't even define how he screamed. Sensitive to touch, sensitive to sound, hyperactive reflexes. Like, for example, if I would cough or sneeze, he would jump out of his skin. Well, all babies have a startle reflex. His startle reflex was impacted up until over a year old. He had a very abnormal startle reflex. Fortunately, we did not go into seizure activity, but we did see the jerking that is often a clinical presentation of NAS. The biggest issues with Camden was he didn't sleep. He was not a normal baby. He did not sleep. You think newborns, they sleep 18 hours a day. He was like an insomniac. So up until he was 15 months old, he didn't sleep through the night. And I was still running a hospital every day. And it is, you know, I have all these cute pictures of him and he looks great. And if you look at me, I've got like these huge circles under my eyes because I was getting up every 2 to 3 hours with him. And he just looks happy as can be. And I'm looking like, you know, I'm exhausted because I am. And he was such a tough baby that you sit back and you think about it and you go, I never knew about why someone would shake a baby. You know, you read about shaken baby syndrome and we educate people about shaken baby syndrome. And in the back of your head, we're all judgmental, whether we want to admit it or not. We go, why would anybody shake a baby? Well, I know why people shake babies. I finally got it. I finally understood because there were so many times I would lay him in the little Mama-Roo thing that bounces. It's supposed to simulate the womb and calm babies. I would have to strap him in and walk away because I was so frustrated. You can only take so many hours of high-pitched crying, screaming, and what traditionally works to calm an infant didn't work for him. You couldn't rub soothing lotion on him. You couldn't hold him. Swaddling worked for a while, but not forever. So a lot of times it was just, I've got to walk away. He's safe. I've got to walk away. I've got to get myself together. I get it. I know now why this can happen to anybody, to any family, because it's hard. It is so hard. And then your brain races about, okay, what's next? And I was probably overzealous in thinking about long-term outcomes. And I can remember going to the pediatrician's office, you know, every 3 months or whenever you go for your checks, and saying, is everything okay? Is everything okay? And the pediatrician saying, he's fine. Look at him on the growth chart. He's a miracle. This is fantastic. And I'm like, Doc, he's not sleeping. And I'm not sleeping. And this is not safe for anybody. And even the physician who was my daughter's pediatrician her whole life, saying, oh, it's okay, he'll get there, he'll sleep eventually. And I kept asking the doctor, you know, how can we see what's next, what's going to happen? And only time's going to tell that. You know, only time's going to tell if there are learning disabilities. I think about the predisposition and fear things like, what does the future hold if he breaks a bone? How are we going to cope with pain? Because I know his brain already knows what that substance makes him feel like, and scared to give him anything. I was so afraid to try anything because I know how his brain was wired in utero. And so that has been interesting. The fear of SIDS was so real for me that if he would sleep a 4-hour block, I would be up in there checking to see if he was breathing. Because I knew all that stuff, and it made me extremely anxious. I can remember calling my husband. My husband works third shift. In the middle of the night, you've got to come home from work. I can't do this anymore. And he's like, oh my goodness, this is serious. The impact was so serious that we had to ask for family medical leave time. Not because of Camden per se, but because I couldn't handle it. It was impacting me emotionally so much that I'd be in the middle of the floor crying while he was crying. And so it was that moment where you go, I'm not good enough. I've never been good enough. And remember, I talked about those emotions. And then you get angry because you see this baby tremoring. You see this baby not sleeping. And who do you get mad at? I got mad at my daughter. Why would you do this? Why would you put him through it? But she's still my daughter. So you can't hate your child. You hate the disease. And it just brings all of these emotions in simultaneously that it becomes overwhelming. The memorable moments that she's missed with her children, they can't come back. She will never see her daughter go to preschool the first day. She'll never see that first Easter or the first time her son ate, you know, a solid food. And that brings those emotions back too. Like, I'm not this child's parent, but I'm having to act as this child's parent. And again, you get angry, you get resentful, And your family unit is so impacted. If I can just tell you about the jealousy, we have 2 other children besides Caitlin in our family unit. And, they won't say, oh, we're jealous of Caitlin. They're not going to say that. But the reality is they are, because she takes the time, she takes the energy, she takes the money. And if it's not her, it's the children that we're raising for her. So I've got 6 grandkids and 2 of them live with me. Those other 4 grandkids feel that strain. So it creates jealousy and tension in the family unit from the sibling side. It also impacts the marital relations. My husband and I are at a place in our life and our careers where we should be able to do things by ourselves and not have to worry about childcare. But we do. The money, my goodness. I have spent a lot of money because of the disease of addiction. Not just in treatment facilities and outpatient and all of the other options, but in childcare. Childcare is extremely expensive, but it's also a health issue. I'm older. I'm doing what people traditionally do in their 20s and their 30s, which is normal child rearing age. So it impacts your health, both physical and mentally. Fortunately, I'm still here, but I don't know how I'm here. I'm just still here. So this disease is not just of that person, but it has literally impacted our entire family unit and our entire family functioning. And always on guard. It used to be before Camden was born and before Caitlin was incarcerated, every time the phone would ring, my heart would sink. It's another overdose. Is this that call that every parent fears? And I don't have that fear today, but I had to prepare for the worst and hope for the best. For the past 5 years now, we're looking at going on 5 years total. So how do you help them? That's the $1 million question, is how do you help them? When do you tough love them? How do you still love your child that's inside that trapped, hijacked brain? And it is hard. And all I can say is they're going to choose those drugs over you. They're going to choose the drugs over your children, their children. They're going to choose it over everything. And it's not because they don't love you or they don't love their children. That brain has been so hijacked they can't not be well. And that's what I want to stress to families. As frustrating as the lying, the manipulation, the stealing, all of the negative attributes of addiction are, is they're literally trapped in their own head and their body is physically responding. Can they die in withdrawal? No, but they'll wish they were dead. And a lot of people will take their lives to avoid that. So it is really about families knowing you got to know your resources, when to reach out, and when to ask for help. That was hard for me. I knew the treatment facilities. I knew the MAT options. I knew about Narcan. I was trained in Narcan. I still carry Narcan in my bag everywhere I go, 7 days a week. There's support groups. Al-Anon is fantastic for families, and people laugh at me. I've got great supports. I'm so fortunate to have great supports. But one of the greatest, most convenient supports I had came from a group on Facebook. And it was a Facebook group about parents of addicts, and people would share their stories and they would comment and they would pray for one another. And it was something that I could access at any time. Facebook is always on. You can scroll through at 2 o'clock in the morning when Camden's been up for the 3rd time. And I didn't feel alone. You've got to rely on people. You've got to be able to ask for help. And that was so hard for me to tell people I can't do anymore. I'm going to break. But you really do. You have to take care of yourself. And I started to see the symptoms, like my weight fluctuated greatly. Either I was packing on the pounds because at 2 o'clock if he's eating, I'm eating, or I was significantly dropping weight. And if you would have talked to me from a clinical standpoint, or if someone would ever get a hold of my journals, my personal journals that I write in, they would say she's clinically depressed because I had all of those signs and those symptoms. I had sleep disturbance, I had weight disturbance, I had emotional moments of, outbreaks, and it feels lonely. I mean, it really does, and that's why the supports are so important. So is it worth it? It's worth it. Probably couldn't have told me that a few months ago when he still wasn't sleeping, but I now would say it's worth it, because today I can look at Carissa. She's almost 6 years old. She's going to start kindergarten in a week, and her ACEs score is a 5, the same as her mom's. And that's important to me because I know how then to send in the preventative measures and put the supports in place. Camden's ACEs scores a 2. And he was born in distress that we can't imagine. I mean, he couldn't breathe, and that for me is a fear. It'd be terrible not to be able to breathe. And then he went through all of the physical ailments, but his ACEs score as of today is a 2. So it was worth it, because had I not intervened, his ACEs score would be extremely higher. As hard as it is, as many times as I've said, what am I doing? I must be out of my mind. I can look back today, I can look at them today and say, okay, now we know what's next, and how to prepare that transition back. The other is true of Caitlin, and I very firmly have said this for a very long time. Dead people can't recover. We cannot give up on our loved ones. We have to be trained and ready to respond with things like Narcan, because if they're dead, they can't recover. Now, how many times is enough? I don't know that answer. For each family, it's different. And we know addiction is a lifelong disease. It's a chronic, relapsing, complex disease. But today she is 17 months sober, not by her own choice. I say the Department of Correction was the one place she couldn't sign herself out of. After multiple failed treatment options, she couldn't sign herself out of prison. So am I glad she got convicted and went to prison? Obviously no, that's not a proud mom badge you wear, but it kept her alive. And I want other families to know, you've got to find your balancing act of when are you enabling, when are you not, and how to cut it off. Yeah, education, support, family therapy, all of those things are important for families to do and to know, and you have to read and know what you're reading too, because there's a lot of stuff that I read that I was like, that's not academic, that's not right. And being able to sort and filter through when is enough for a family. I can't answer that. I can only say that for my family, we're going to give it another shot. And so when she comes home and she meets her children, she has a lot of acclimating to do, and we have a lot of challenges ahead of us in the coming months, but she's recovered at this point, and I'm going to support her as she makes this journey into long-term recovery, which we know is possible.
Welcome back. That was a very impactful story from Katrina about her family and her loved ones. So we thank you, Katrina, for sharing that story with us and with the world. We've had several questions being posed around that we'd like to ask our expert, Dr. Anwar. So throughout that story, Katrina was talking a lot about medication-assisted treatment and a little bit. Can you tell a little bit more to our viewers, what is MAT?
So when we're talking about addiction, in lay term we call it addiction, but actually the term is substance use disorder. And it includes all the substances. There are about 14 substances which can make a person addicted to using them, and according to that substance, the name of the that substance use disorder is made. So when we're talking about medication-assisted treatment, it is basically opioids, but the difference being that methadone is the total agonist, that it binds to the same receptors as the opioids and bring about the similar effects. So this medication is only prescribed by opioid treatment programs. And you need daily dosages. The patient needs to go to those opioid treatment programs, get their daily dosages of methadone, and then they can manage their opioid use disorder. The biggest risk factor with methadone is that it can cause the overdose as well, because it is essentially acting as the opioid. So if a patient takes more methadone than is being prescribed, then they can also die of the overdose deaths. That's why it is very strictly controlled by the prescribers. Buprenorphine, on the other hand, is a partial agonist, and it is kind of like the gold standard for opioid use disorder treatment. And this is prescribed, it is partial agonist. It takes off that edge that the patient feels as a result of the detox or the withdrawal effects that are being felt, that are felt by the patients when they're taken off the opioids. But at the same time, they help the patient to lead a productive and self-directed life. The third one is naltrexone, which is also called as an antagonist, which acts in the completely opposite manner as the opioids, and they do not let the opioids bind to the opioid receptors, and as a result, the patient does experience withdrawal. But the good thing about that is that it is available in injectable form, so that it can be administered after a month or however the prescription of that is being conducted by the prescriber. In addition to medication-assisted treatment, I have to stress that there needs to be that behavioral health and the therapy that needs to come with that, the support that is needed by the patient, because medication alone cannot treat the opioid use disorder, although it helps manages the clinical symptoms of the opioid use disorder.
Right, it's that wraparound of support. That's very important. So please, if you have questions, be putting them in the chat. We're also going to show a link real quick. Don't forget that you can go out to this link, ask a confidential question that our team here will receive, and will reach back out to you in whatever method that you prefer. We did have another question come in. So during Katrina's story, she talked a lot about overdose, today's International Overdose Awareness Day, and she talked about naloxone or Narcan as something that she actively carries still to this day. What is Narcan?
So Narcan is that when we talk about opioids, and I didn't get into that detail when I was talking about medication-assisted treatment, but when we're talking about overdose, it actually suppresses the respiratory system, and that's how people actually die of overdose. So Narcan is a drug which is a life-saving drug. It immediately reverses the effects of those overdose, and it knocks off the opioids from their receptors, thereby enabling the person to breathe again. Narcan in Indiana, by the standing order, is available at the pharmacist. You can get the Narcan. It is available in the nasal form, where you just push it into the nose of the person. And then the other one is also the injectable form. It is available at the local health departments and also at the Indiana State Health Department. Our program, Indiana Rural Opioid Consortium, is also providing Narcan training, in which you learn how to use that Narcan, and then those Narcan kits are distributed to the participants of that training, and you can get more information about that on our website at IRHA.org. And if you go into there and get some information about our virtual events, you will find the dates for the available Narcan trainings.
Wonderful. Well, we have another story that we'd like to share with you today. As we've witnessed with Katrina, substance use disorder is really a collective ailment, even as each individual experiences it affects differently, including family members who are not using. Apart from the constant stress of watching a loved one struggle with addiction, the circumstances of substance use disorder can turn violent. The World Health Organization tells us that alcohol consumption, especially at harmful and hazardous levels, is a major contributor to the occurrence of intimate partner violence, and links between the two are manifold. Kara Dawson and her son will now share their story of abuse at the hands of her ex-husband and her difficult journey to safety.
Thank you all for having us here today. My name is Kara Dawson, and I am a Quality Improvement Advisor for QSource, which is the Quality Improvement organization for the state of Indiana. And with me today is my son, Zachary Dawson, and he is a senior at Purdue University studying mechanical engineering. And we're just really excited to be here today to talk to everybody about the effects of substance use disorder on the family, me as the mom, and Zachary as a child growing up with someone who had a substance use disorder. For me, growing up, I had a very normal, great childhood. Always looked forward to getting married, having children, kind of the white picket fence persona that everybody always dreams of. I ended up meeting Tony when I was 27 years old. I had graduated from nursing school. I was working. I was a professional. Everything seemed great. Me and Tony had gone to high school together, and we were friends in high school. For me, I noticed the substance use even before probably we were married, but chose not to take those red flags that I saw, and thought that I could help him change. And so he was in the Air Force and was a part of Desert Storm, and came back and found out very soon after he had come back that I was actually pregnant with Zachary. And that's when I noticed his substance of choice was alcohol, and large amounts of alcohol. And that's when I noticed it getting worse, is when he came back. So for me, everything was normal. I saw the substance use as a problem very early on. Then felt like that it was my duty as his wife and a soon-to-be mom that to help him and to get through this situation.
I guess it was a part of my life from the moment that I was born. So to me, it was regular, everyday life, him being that way. And I guess I didn't really realize it was any different than what, say, another kid would have until second, third grade. I remember, like, you go over to a friend's house and it's not that way, and it becomes apparent pretty quick that there's something going on, and you always kind of lived behind this wall where we were in this perfect little bubble, and we didn't want anybody to know that this was going on, and it always was.
Some of the signs and symptoms that we noticed as I got farther into this relationship, we dealt with a lot of violence. He was very physically abusive to me. He was mentally abusive to me, and emotionally abusive. He felt like because of his job and his duty with the in the military, that now everybody owed him. And so, like Zachary said, we kind of lived in this bubble. It was very embarrassing for me as a professional person. Didn't want anybody to know, hey, when I go home, almost every night I'm getting beat up. And almost every night I'm going home and I have a sick feeling in my stomach because I know that he's been drinking. It's almost paralyzing. So no lights on in the house. Had to be quiet. We all got used to not drinking our drinks. We kind of laugh about it now, but we didn't get ice in our drinks because that might wake him up. And if he came home and he had his rage, once he was out, we were good. So it became a pretty consistent pattern. And so that's really when I really realized that something was wrong, and that this was way deeper than I even maybe had thought about. The violence just kept escalating, and I could see it affecting my children. Zachary, being the oldest, really kind of took on that protector role for everybody, and really took on that father role for his two younger siblings, and then relying on my parents who lived in town to help get him to school, help pick him up from school. Where are they going to go? Because when I get the call at work that you're going to bring me money now, even if it was the last $20 that we had. Trying to deal with all of that and not wanting anybody else in the community, especially the people I worked with, to know, because I had people coming to me in the same situations and I'm giving them advice. Oh, he's not going to hurt you if you leave. You need to get out of that. And then feeling very hypocritical as I'm driving home, knowing what I'm driving home to. Looking back, we had very extensive workups through the VA when he came back from Desert Storm. He did some relief efforts in Bosnia and Somalia, and so we knew that there was some mental aspect happening with him when he came back. Initially, we couldn't get that mental health diagnoses, right? But I knew pretty early on, just from my medical background, that we were dealing with something above just substance use. And he would talk frequently about the alcohol took him away. He didn't have to think about things, right? But, the blinds being closed, no lights on. He had a bat at every entrance of the house, very paranoid. When planes would fly over the house, you couldn't approach him from the back. Finally, pretty late into our marriage, he did get diagnosed with post-traumatic stress disorder. I think the failure in my mind was that I can't help him. As much as I try to control the situation, the more out of control it was. And even with that diagnosis and him being on the medications for post-traumatic stress, it's hard to get them to go into those appointments. So if he's drinking at least every other day, he's not going to make it there. There was a lot of mental health issues that for him, and along the way, mental health issues probably for me as well. You can't leave me because if you leave me, I'm going to kill you. I'll find you. I'll take the kids. You'll never find us. So it was, for me, keep your friends close and your enemies closer. And really started feeling like that he was that enemy in my life. He was a great guy to everybody else out on the street, right? And no one would know. Did I see it as a disease when I was in the thick of it? No. Because what I heard so many times, you are the one that isn't being reasonable. Maybe not. Maybe I wasn't, but living in that situation, I needed someone on my side to say, this is what you need to do. And that isn't what I got, and it may be because we were within a system that very much caters to servicemen and women, which rightfully so, but can't forget the families that you're sending them back to. I needed to be more prepared for what I might encounter. Sometimes I have to check myself even today to say it is a disease process, and be more understanding, because when you live it, it makes you angry and kind of callous. I didn't have that support, and part of it's my fault because I didn't want anybody else to know. It was an embarrassment for me, and I thought it made me look weak. I wanted people to think that my house was happy and everything was normal, when really it was very dark and gloomy.
As a kid, I think the things that I saw, number one was we were always trying to not be at home when we were home. I mean, as I got older and started realizing, it became obvious pretty quick that there were things that were being hidden. There was always, the alcohol was always tried to be hidden, but it became hard because if he left, we came home, it's all around the house. So, and it became really apparent really quick that it wasn't the same as what other kids had, especially as I got older. I feel like I did kind of take on that protector role because as I started becoming cognizant of the fact that it's going on and I'm realizing what it is, of course I don't want my little brother and little sister to feel the way I feel or see what I see, kind of in the same way that Mom was. So I was getting up in the morning, making sure people were getting ready. Grandma came and took us to school because Mom's at work. Dad's passed out. You don't want to wake him up. So I'm the one getting up. I'm the one doing things that, I guess, to be fair, kids my age probably weren't doing. I think it changed who I was early on. I mean, it affected me socially because now I feel like I matured. I was somewhere up here and kids around me, they aren't worrying about what I'm worrying about at home. So I can't relate to, like, this kid lost his Pokemon card. I'm going home trying to keep my little brother and little sister from seeing things that are going on at home. And looking back on it, it's different than what it felt like then, because then it was just, you wanted him to go away. You wanted it to be normal. You knew that it was possible for it to be normal, but you knew that he had to go away. And I mean, there's times where you get pretty dark in your mind about, especially as a kid, I mean, about him going away. Mm-hmm. Whatever it took for him to go away, and wanting it to be normal. And sometimes it felt like that wasn't ever going to happen.
The stigma for me that maybe I was so concerned about is, number one, I was a nurse. I'm supposed to be a strong person. I'm a mom. I'm a protector of my kids. I don't want people to know that my house is not running like it should be in my mind, right? I don't want people to know that my husband is abusing me and I'm staying. What's going to happen if I leave and something happens to me? And then there would be those days that he wasn't drinking, and I'm sorry. And he was the person that I knew that I had met, that I knew I wanted to be with. And how can I leave him? If I leave, do I look like the bad guy now that I've left someone who is going through this? And I'm supposed to be able to help people. I'm a nurse. Medical. How come I can't help him? I help all these other people. How come I can't help him? Maybe it is me. Maybe when he tells me it's me, it is me. I didn't want people to see me as weak. I didn't know that I needed help. When you're in the thick of it, I don't know that you really know that you need the help. And if I get help, does that also make me not look like I'm in control and that I'm strong? Never mind that. When I was in the situation, to go and get the help meant that I knew I was going to go home and reap a repercussion from him, because he didn't want people to see him in that light either. I guess it was always an excuse, but I do think there's a huge negative stigma in our society about substance use disorder. They're no good. They're not going to get any better. And why would she stay? It's her own fault, right? And after I was with him for 14 years, and I finally knew that I had to make that break, and I did so, but it was humbling. I had to go live with my parents again. I had 3 kids who, after I left, I realized that they were much more affected by that substance use than what I even knew at the time. There was a huge amount of guilt for me, thinking that I wasn't the mom I needed to be, maybe, but knowing that in the thick, if I left, in my mind, how can I leave? I know that I'm gonna have to let the kids go and see him. And the thought of them being with him by themselves was worse to me than what I thought I was doing to try to protect them at the time. When I was really in the thick of the whole process and that life that I really even knew that I needed the help. But looking back, I was really just enabling a situation to continue to spiral out of control.
Growing up, I mean, when I was that age, we didn't talk about it. He was around once in a while, just enough to pull off the facade that he was around, he was normal. Me knowing well in the back of my mind that that's absolutely not how it was, and we didn't talk about it, we hid it. People didn't come over, and I don't know that I ever had any friends that said anything about not coming over to our house, but I knew why, so it didn't ever strike me as odd, I guess, growing up that nobody came over, because I don't guess I felt like growing up I was at home that often. So it wasn't odd to me to not be at home.
So yeah, I mean, looking back at it now, obviously I left the situation. Probably the hardest thing I've ever done in my whole life. The scariest thing I've ever done in my whole life, hands down. Most humble thing I've ever had to do, live with my parents for a summer. You feel like you're a kid again, but also a mom, and now my kids are listening to my parents more than they're listening to me, because my dad kind of was that father figure for them for a minute. But looking back now, obviously, I see things much differently because I'm not in that situation. I'm not fearful anymore. Would I have done things differently? Absolutely. Do I have guilt every day of my life? Absolutely. I wish I would have left way before I did. And then part of me says if I would have left too early, then I wouldn't have all three of my children, right? Which were the biggest blessing ever. But most certainly I wish that I would have gotten out of the situation, and most certainly I wish that my kids would have never had to be in that situation. And I can separate for him. In my mind, I get it's a disease. I get that it really wasn't who he was, because I knew him before that, right? I knew him before he had the substance use disorder. I knew him before the drinking. So I do think that the mental health played a large part. Do I still have a little bit of anger and resentment? Probably. Has it gotten better? Absolutely. So after I left, the drinking continued, obviously, right? And he got into some more trouble, and unfortunately, he died a couple of years after I left. And oddly, when that happened,
It's kind of freeing.
yeah, you're sad. You're sad that he never got the help that he needed. But for I think I can speak for me, Zachary. I think I can speak for all of us. It was almost a relief that we don't have to worry about if he drinks again. I don't have to worry about if he tries to come and break in our house when he's drinking. I don't have to worry about him stealing things from me anymore. But sad all at the same time. I know it doesn't make a lot of sense, but it's kind of that combination feeling a little bit. And so, once we left and we moved away from our town, as a single mom with 3 kids who's never lived by herself before, it was scary. But now, happily, at the end of the tunnel, I remarried, and they have that father figure that they always longed for. And so I don't know. Now looking back, would I've done things differently? Absolutely. But you can't second guess because you do the best you can.
I guess kind of on the flip side, for me there was no separating him from the alcohol, and there still isn't in my mind. To me, that is him. And I guess for the good or the bad, there were good days, sure, but to me there were a lot more bad days. So you try to remember the good days, but to me he will always be the person who abused alcohol and did what he did. And I mean, I second everything she said. It was him dying, absolutely it's kind of a surreal feeling almost. You're sad that he's gone. For me, I was angry that, you don't get the opportunity to talk to him about it as a grown person who can talk to him that way. But at the same time, it's freeing.
So I think my biggest suggestion to someone who's in that, and my biggest hope for someone who finds themselves in similar situations, is that it's okay. It's okay. It doesn't make you look like a lesser person to go and get help. Get the help that you need. Reach out for help sooner rather than later. It's not your fault. You are worthy of having the help. And you can't change that person. That's the biggest thing. You by yourself you can't make a difference. That person has to make their own difference. Don't be fooled that you are protecting your children. Don't think that they don't see what's happening and they don't feel what's happening. Because from one mother to another, or to a father, or to whomever, they know more than you think, and they sense more than you think. And get them the help they need as well.
My biggest thing, if there's a kid out there that is going through this, know that you're not the only one. I mean, because me growing up, you feel like you're the only one. You're on this island alone where you are different than everybody else, and you are dealing with something different than everybody else. And I know now that there's other people out there that are going through it, and know that it's okay to feel the way you feel about it, and that at the end of the tunnel there's always light.
Welcome back. Thank you, Kara and Zachary, for that very heartfelt and moving story. There's a lot there. And we want to remind you, please, if you have any private questions, we have a link that you can go out to that will be displayed here. This link will stay active, so if you're watching this after our live event on International Overdose Awareness Day, please feel free to still complete that link. Our team will get in touch with you and be able to support you. So please don't hesitate to fill that out. Comments, if you have any comments right now, please leave those in the comment field, and we're archiving all of those as well. If you're watching the recording though, and you do have a question, even if it's not confidential, please feel free to put in that link, because that's where our team is going to be monitoring those. We do want to highlight that coming up in the month of September, which is hard to believe that starts tomorrow, but in the month of September we're going to be doing 3 specific awareness days around opioid overdose and the opioid crisis. On Tuesday, September 15th, we'll be doing an event dedicated to Lawrence County. On Tuesday, September 22nd, we'll be doing an event dedicated to Wayne and Fayette counties. And then on Tuesday, September 29th, we'll be doing an event for Harrison County. Those will all be done live via Zoom. So if you want to go out to our website, www.indianaruralhealth.org, and go over to virtual events, under the events tab to virtual, you'll be able to select there, and you'll be able to register for those events to get the link because that'll be a little more interactive than we're doing right now. You will be able to ask questions to our presenters throughout the day. Dr. Anwar and I will be back to host those events. We're looking really forward to those. So coming off that Karen and Zachary's story, Dr. Anwar, there's a lot of discussion about the linkages between other behavioral and mental health conditions, military service, and PTSD was mentioned, as well as substance use disorder. So what do we know? What does the science show us about the linkage between other behavioral health conditions and substance use disorder?
So when we're talking about substance use disorder, I think the most important thing to remember is that this is a chronic disease. And just like other chronic diseases, the etiology for this disease is also very complex. It has its risk factors, 40 to 60% of which is genetic, but then there are also social and environmental factors, and then obviously there is exposure. So when we're talking about risk factors, there are a lot of things which can lead as risk factors for substance use disorder, and behavioral health disorders are one of those risk factors, which can include trauma. This trauma can be in the form of what our veterans experienced during war, and then this trauma can also be the one experienced by someone as a result of domestic violence, or this can be as a result of violence as child abuse, which is experienced by children either at their homes or at other locations. So this is a risk factor which increases if a person already has a genetic predisposition, and then you couple that with these risk factors, and then eventually that person is exposed to some of the substances. For example, usually the first substance most of the time that people are exposed to is legal. That is alcohol. It is easily available in our homes, and that is the substance that the persons usually, that's the first one that they experience with. Previously, it was also called as gateway drug, just because of the fact that this helps the person take that first step towards using substances. So the link is there, and we can break some of those linkages if we understand this as a disease, and if we see it through the lens of that chronic disease, and we manage it as chronic disease.
So you also, throughout the story and then also through our discussion there, there's this concept of adverse childhood experiences. And we got to learn more about Zachary and his siblings' experiences along with Kara's. What is ACEs as well?
So adverse childhood experiences, as I mentioned, it's not exactly, we cannot just say that it's trauma, but there are various different experiences, and there's a whole questionnaire that you ask those questions from the people, and the higher you score in those adverse childhood experiences quiz, the higher your risk of developing any sort of substance use disorder or behavioral health disorder. It exists. So it is also known that an ACEs score of more than 6 usually also it results in a higher healthcare expenditure. So all of this is interrelated, interconnected, and there have been studies in the past which have linked the ACEs to other behavioral health disorders and substance use disorder, including opioid use disorder. And we will see a little bit of that in our next story, and we have seen that. Katrina mentioned that in her story as well. So the score was different for her grandchildren, and that is a very important factor in the prognosis when it comes to the substance use disorder.
Right. So I think you segued really well into Charmin's story that we're going to learn about next. So please, during this story, if you have questions, add those to the chat, use that red cap link, and then we'll come back. So we're now going to lead into Charmin's story. So unfortunately, trauma is a part of too many children's lives at too early an age. Environmental factors like chronic stress and other traumas like abuse, neglect, or violence in the home, collectively known as adverse childhood experiences, can sometimes manifest risky behaviors later in life. During adolescence, for example, some young people may develop unhealthy coping mechanisms that are harmful, like substance uses. Charmin's story is one of childhood trauma resulting in her becoming a patient with substance use disorder. However, Charmin's story is also one of incredible resilience, having overdosed twice and having contemplated suicide before starting her recovery journey. So let's learn more about Charmin's story.
So my name is Charmin. I'm the coordinator for the Fayette County Harm Reduction Alliance. I'm a recovery coach, and I'm also a person in long-term recovery from IV drug use. My story goes back to early childhood. I was born and raised by a mother that has multiple mental health diagnoses, such as schizophrenia, bipolar, depression, and anxiety. I was raised by a father who was an untreated alcoholic and has mental health issues himself. My mom had a gambling addiction growing up, and so early on it set the tone in our home for lots of physical, mental, and emotional abuse. And not only was my mom physically abused, my brother and I was as well. Three things I had learned very early was we had many secrets: don't talk, don't tell, and don't feel. I remember one morning being awoke to my mom screaming and begging my dad not to kill her. My dad had my mom held up against the wall in the kitchen, and I was about 5 years old. And she was just screaming and crying and begging him not to kill her. And my mom had spent money that was unaccounted for, and so it goes back to that gambling. I remember just so many times that after my dad would beat my mom, that he would get in his truck and leave, and then we would be there to clean up the glass, and we never talked about it. My dad would come back. My mom would, she would get up out of the bed, or and so we were just quiet. Us kids were always just like as quiet as we could be, to be the best that we could be, so that he wouldn't be mad, it wouldn't hurt her. And what I learned was that love was angry. Love was hard. I tried to do well so that things would be better. When I started school, we were very poor. My dad worked, and my mom was a stay-at-home mom. We didn't have running water until I was in the 4th grade. My mom had this old ringer type washer, and even in the winter she would hang the clothes out on the line to dry. So oftentimes our clothes would be soured. And I remember we would take baths in the creek. So my name was Charmin, and we were poor, and I had cavities in my front teeth. So I had a speech impediment, and I was made fun of a lot. And that's what I knew. That was my daily life, was not knowing if I was going to get off the school bus, to my mom even being alive. That was one of my biggest fears, was that my dad would kill my mom. My first drink was 9 years old. I drank beer when I was 9 years old, and I'll never forget that feeling of warmth. And I describe it as walking outside on a sunshiny day and feeling that sunshine hit your face, and you just have like this amazing feeling. And that's what the alcohol felt like inside of me. It was warm, I was safe, and maybe even a feeling of maybe liking who I was. It was just a secure feeling. And so I think that was a feeling that I started to long for. I remember being around the 3rd grade, my mom started taking my sister and I to the store to shoplift. And she would send us in the store, and we would get things, whatever it would be. And I would do it to cover up a lot of things, I think, for my mom. So the secrets, I lied, I stole, I was angry. When I started junior high school, I started surrounding myself with kids that accepted me, and being able to skip school and not take that bus back home to the country. I would do anything not to go home. I just didn't want to go home. You just never knew. You never knew if my dad was going to flip the dinner table, if he was going to break another lamp over her head, if he was going to break her fingers. She would say she stayed for us kids. My dad said if it wasn't for us kids, he would leave. So I think that put like a lot of guilt on me, like it was they stayed together because of us kids. In reality, us kids would have been better off had they have separated. So I fell into that cycle of drinking and smoking pot real early, and it became, I think, a coping skill for me. And So everything that I hated about my parents, I became. I lied, I cheated, I stole, I was angry, I fought. I would fight. I had an older sister that was overweight. My siblings were in special ed, so kids made fun of them. And so I would fight to take up for my siblings because it hurt me to see them being made fun of. And I missed like 80 some days of school in my 8th grade year, and they labeled me incorrigible and they passed me on. I overdosed on 2 different occasions while I was still in school, and one time I remember they found me like laying out in a yard, and I was naked, and I was unresponsive, and I remember when I woke up that my parents weren't there, and the nurse said that they weren't coming. They were mad. My parents were mad at me because of my behavior. And looking back at it, I think I just wanted maybe someone to love me, to help me. I just didn't want to live. I didn't want to continue to go home, and I didn't have those people in my life, even the people at school. Like, I was a problem. So no one ever seen that I was a child in need. I was just labeled incorrigible and a problem. And it was just too much for people to deal with. And so I ended up quitting school. In high school, I would attend school, and I probably don't even have 12 high school credits. I was just continually passed on, and I quit what should have been my senior year. And so that led me to being eventually having my first child 2 weeks before I turned 19 years old. And so for me, there was a desire to be a mom, to raise my first better than I was raised, but I didn't know how. I didn't know how to do different. I didn't have people in my life to help guide me and support me. And what ended up happening with me, I was addicted to shoplifting. I was addicted to pills. I was addicted to alcohol. I have a substance use disorder. I have mental health diagnoses of bipolar, depression, anxiety, PTSD, and I had an eating disorder. To expect this young child to break those cycles was what the criminal justice system wanted from me, but I didn't know how. And so I have spent over 10 years of my life rotating in and out of the system. Never was I ever arrested for anything other than DUIs, shoplifting, all low-level nonviolent crimes. But yet, every time I would go into the system, I would be sober, or else being in the system was another opportunity to learn different coping strategies. So in there, mental health medications are something that's highly abused, and Benadryl was another piece inside the system. Anything to escape those thoughts inside my head, like being raised by parents that weren't healthy. I on top of the mental and physical abuse, being told that I was hated, and the names that my own parents would call me, they too told me I was worthless and that I would never amount to anything. And so I believed that. I never had dreams of growing up to be anything. I never had a dream of going to college. My dreams as a younger person consisted of getting out of that house. That was my only dream, and that was my only goal. And then when I did, then I had a child. And then I started parenting him the same way I was parented. And I stayed in an abusive relationship And every time I would get out of jail, I would go right back to doing the same things because I didn't know how to change. There wasn't any help. It was a temporary holding and then being released right back to society, or going back to my parents' house where it was like I was already defeated before I got there. So throughout my life, I learned my own way to be. I learned that I could go to a provider and I could get the medications, and the medications that I ended up eventually, I had a prescription for 120 pain pills, and they would be gone in 3 days. And there was never questions as to why I was taking all these pain pills. It was just, then early on, there weren't all of the regulations that we have today with medication. So what that led me to was taking Oxycontins. There was just never enough. I would take 20, 30 pain pills at a time, and there was never enough medication to help me get through what was going on inside of me. And that led me to, I remember the day that I paid $80 for an 80 milligram Oxycontin, and I just got well. It was, I just got well, and that wasn't enough. And that took me to heroin, and eventually I had a second child, and when he was like 3 years old, I ended up on heroin, and I continued until I lost everything that we had and I had with my second son's dad. I remember the day that I was arrested coming back from the city, Dayton, Ohio, and the Jeep was impounded, and we still owed money on the Jeep, and I was arrested in Wayne County, and after 48 hours they OR'd me. And I went to the impound, and I sold them the Jeep for $75, just enough money to get back to Dayton to buy a gram of heroin. Like, it was always about the immediate escaping what was going on inside of my head, because I went to jail, and so that just added to the guilt and the shame and the pain and the self-hate. Eventually, in around 2013, that sentence from Wayne County, I went into a program called, it was a therapeutic program. And so the system had started to change, where they were offering programs, and now they do offer programs for substance use inside if you're lucky enough to get into one. And through that program, I started working on me. I didn't even know why I did what I did. I didn't even know why I was so angry and why I didn't like the person who I was. When I started dissecting the pieces of my life and looking back to, I wasn't even 6 years old, and I was molested by 3 of my cousins. And I think that started the body image issues that I had. And then eventually I've been raped and abused, sexually abused by men and women. And then not even, my parents' sex wasn't something that they talked about. I didn't even tell my dad about my cousins molesting me, because I was afraid he was going to beat me for what they done to me. Like, sex was bad. It was shameful. And it was just something you didn't do. And so I didn't even have that person that I could tell it to until I was 30-some years old. Those were secrets that I just had to keep inside. And so when I was in the program and starting to look at my life, and I started understanding, but I still didn't want to tell all them deep, dark secrets. And so after being released from prison that time, I went on to work release, and while I was incarcerated with structure, I done well. It was like I had a goal, and that was to get back home to my kids. while I was in work release, I had a job that I was promoted to manager. I was downtown Indianapolis. I saved a lot of money. Just a lot of things seemed to be going good. Yet still that same person with those same coping skills was released back to society. And I was on parole, and like I had all of these expectations, no driver's license, and all of these demands that they want from you. Within 2 weeks of being released, I was back shooting dope. And this time I was back using drugs with my 19-year-old son, the person that I loved more than anything in life. And I just didn't, like, there was nothing left for me, like, inside of me. Drugs, heroin completely had taken over everything, and that's all I wanted. I lived for the next fix. That's all I cared about, was getting back to the city to get high. And there were days where I would put my youngest son in that car seat, and I would go to Dayton, Ohio, no driver's license, just enough money to get a gram of heroin and to buy my son a Happy Meal. Because in my mind, it was justification. I would give him that Happy Meal, that toy, and I was getting what I wanted. And I was so far gone mentally that that some days there wasn't even enough money left over to buy water. That the nearest piece of whatever it took to get it injected in my vein was what I was doing. I've shot mud puddle waters. I've mixed mud puddle water with heroin. I've shot toilet water, and I know that sounds awful. And I can't even believe that's the person that I was, but I've done that, because when you're in that bathroom, you're so afraid to walk out of someone seeing you, and you only have what you have. And so to draw up water out of a toilet and to mix it in a pop can bottom, because it's usually what you have, and it's whatever's closest to get it into your system. My son came and saw me right the night before I left for prison, and when Drayden left with his dad that night, he was only 7 years old, and the jailer handed me a letter. And this letter was wrote in, it's a green marker, and it says, "You are so a good mom, and I forgive you." And I knew that if my son could forgive me, and he was about to be put on a bus every morning without his mom, getting off a bus without me there, just everything that he was about to go through. And if he could forgive me, then I had to learn how to forgive those people that had hurt me in my life. And so I took that letter on to prison with me, and that was something that I had to learn how to do, was forgive people that had hurt me, and I didn't know how, and it was a huge process. My story takes me back to being arrested again in 2014, July 3rd, 2014. I was arrested, headed back to the city, 1 o'clock in the morning, and I was so tired, and I just didn't want to live anymore. And that night that I was arrested, I knew that I just couldn't keep going, and I didn't want to keep going, because I couldn't stop doing drugs. And I knew I was going back to prison, and I knew that everybody, that my parents loved and supported me the best way they knew how. But I also knew, like, they hated me. They hated the person that I was. And my kids, like, they just wanted a mom. And I couldn't be her. I had planned to commit suicide that night. I just didn't want to keep living with all this pain inside of me and all these secrets and the way that people would treat me when like even going to the emergency room. I was a known IV drug user. I wasn't as important as the next person. My life was so invaluable to so many people except my children. And I don't say that because I feel sorry for myself, because today I see myself differently and people treat me differently. But that's only because I found a pathway. So what ended up happening, thankfully for me, many people were placed in my life. And my oldest son said to me, he said, "Mom, I'll be fine, but Drayden needs you." And God placed some amazing woman in my life that evening, and I call her my angel here on earth. And some of the things that she said to me, and the thing that stuck out the most was, she said, "Charmin, I sucked as a mom, but I'm a darn good grandma." And that woman stood beside me, and she loved and supported me without judgment. She heard me, and she wanted me to know that I mattered. And so I ended up going back to prison, and during that time I went back into that program, and many people in my life. There was the director of that program. She mentored me. A woman from the outside mentored me, and gave me 32 weeks of her life, and I did work a 12-step program inside the prison, and I had a life-changing experience inside prison. I gave it everything I got because I knew I was going to die if I didn't change me. And I wanted to, I just didn't know how. But God placed every single person in my life that I needed to have to help me learn how to forgive. And so April 2015, I was released from prison. And when I was released from prison, I had a few clothes and a GED that I got when I was a patient in Richmond State Hospital. And since then, when I came out of prison, I was just willing. I was willing to do whatever it took to get to be where I wanted to be in life. And I still don't know where I want to be, but I was offered a job landscaping and mowing 5 days after I came home, and I took the job. And I started going to peer support groups, and I started doing anything that I could positive within this community to change me and to be connected. And working that 12-step program helped me find something that I never knew existed, and that was a connection to a higher power. And so I didn't think God applied to my life, because the God that I knew was vengeful and not loving and not forgiving. The God that I grew up was like a mean God. So I learned more about spirituality, which brought me to where I'm at today with my connection. And that's what changed my inside, was having a spiritual connection. So anyhow, getting involved with Celebrate Recovery helped me. There was other support groups at that time, but it was the people that heard me without judgment. The people that they were there with open arms, and they were people that had been on similar pathways. So one time I was someplace, and I asked what I could do, and they told me to go to the Drug Coalition. It was actually the Drug Task Force. And so I showed up at the Drug Coalition here in Connersville, and there were a bunch of professionals at that meeting that day. And they're like, "Let's go around and introduce ourselves." And at that time, I was just going to school. I had started online school, because I still don't drive. So I didn't have that ability to get to in-person school. So as they were going around the table, and they all had all these titles and whatever, and I said, "My name's Charmin," and I, at that time, I used language such as, "I'm a drug addict and alcoholic, and I just want to make a difference." And so as time has went on, I no longer refer to myself as a junkie or a drug addict or I'm a person with a substance use disorder. Most importantly, I know I'm a person today. All the labels that have been placed on me by society, a victim, a victim of rape or molestation or incest, none of those are who I am. Those are things that happen to me. I am a person. Today I'm a person with a bachelor's degree in psychology. In July of this year, I graduated a bachelor's program in psychology, and the same day I became a homeowner. I am 6.5 years in recovery now from multiple mental health issues and a substance use issue, and I'm a mom. I am a healthier minded mom. I'm a mom of a 14-year-old that is a normal teenager. I'm a mom of a 27-year-old that is on mats. He has found his own program of recovery, and he's very successful. I'm a very proud mom of 2 boys, and I get to love, support, and encourage them. And I do that every single day. I might not reach out to my oldest every single day, but every day I get to wake my youngest up with breakfast before school and encourage him. I don't belittle my children. I've learned a different way to be, and that's because people invested in me, and I've learned tools through my recovery to be able to be a different person.
Wow, what a meaningful and impactful story. We thank you, Charmin, for sharing that with us. Definitely a lot of takeaways for that. We want to thank you all for being with us for this 2-hour event, our first time at IRHA doing a YouTube live event, so we thank you for participating with us as well. We want to remind you, if you missed at our last transition between videos, that we do have 3 events coming up focused on opioid overdose and awareness. These events are all designed in a way for entry-level community members who don't know a lot about this topic, who may have a loved one that they want to know more about and how to support them. They may know someone that they want to learn more. They just don't know much about these issues and concerns and want to be able to support their community better. These are all on Tuesdays, 3 weeks in a row. So on the 15th of September, we have an event centered around Lawrence County. And when I say centered, we have different community members who are going to stream in with us and have a discussion from their perspective what this looks like. So on the 15th is Lawrence County. On the 22nd is Wayne and Fayette County. And then on the 29th is Harrison County. These are all Zoom links, so we can have more two-way interaction. So I encourage you to go out to our website, www.indianaruralhealth.org, go over to events, virtual events, and you can sign up. Now, if you're like, I'm not from those counties, but I want to be more involved, I want to learn more, please attend those, right? They're open to anyone. I'm sure you'll learn something at them. I've learned from all of them as we've been preparing for them. They're going to be wonderful events. We also want to put a link real quick going back out to our REDCap website. So if you have a question that you're not comfortable asking in the chat, maybe there is some stigma associated with asking that question, please, this link, we'll be monitoring it after this event is over for the next several months. So if you have a question, please feel free. Those will go to Dr. Anwar and myself, and we'll be able to help facilitate and get you the support you need. So please use that link. So Dr. Anwar, going back about Charmin's story, there's a lot that we really could spend the whole 2 hours in each of these stories having a discussion about them. But some of the things that we really there was, in Charmin's story, there's a lot of discussion about the criminal justice system and the role that played, both in the negative and in the positive. So what is the role of criminal justice system, or what can we as citizens do better to support that?
Unfortunately, substance use disorder has been criminalized in the past. The reason being that the patients of especially opioid use disorder, their decision making gets hijacked by the drugs. So every decision that they're making in their life is to get that next fix, and this leads them down the pathways that they end up with the criminal justice system. And when we are talking about, as public health professionals or clinical professionals, about the patients with substance use disorder, we're talking about patients. So we have that compassion and that respect that a patient should have. But when the criminal justice system is seeing them, they're at their worst. So the fact that the criminal justice system gets entangled with the getting these patients off the street because they can be harmful to themselves or they can be harmful to the people around them, there is a role that comes into play just because of that. But at the same time, we have to realize that criminal justice system can play a positive role as well, because it does provide them with the structured environment that the patients need, and it also provides them with the lack of the exposure or the access to the drugs. It's just the matter of how you use that time that these patients are within that criminal justice system to provide them with the access to medication-assisted treatment, to the support treatment that we have talked about while they are incarcerated, or they can be diverted from being incarcerated into treatment. So that is something that I think we can work with the criminal justice system, where it can play a huge positive role when it comes to the patients with substance use disorder. So just saying that criminal justice system, as of now, because of the lack of resources and lack of, I would say, the awareness, or just bringing them on board to medication-assisted treatment, to other sources of treatment for the patients with substance use disorder, that disconnect is there because the patients are just going into the system, they go through detox, then their threshold for the substances that they've been using is decreased, and when they're released back into the system without any support, the first thing that they reach out to is that substance that makes them feel better. So that cycle can be broken if there is support and treatment available through the criminal justice system or in collaboration with the criminal justice system, which is happening in Indiana. We have some of that happening in Boone County. Then we also have some of those clinics which are working with the drug court system down south. So at some places we are seeing that, but we need to see more of that.
Absolutely. Thank you. So when we talk about substance use disorder, I mean, there's kind of three pillars, right? We look at prevention, so how do we make sure this doesn't happen, which is ACEs, and we talk about adverse childhood experiences. We look at treatment, medication-assisted treatment, but then with Charmin's story, we really look at that third pillar of recovery. What do you want our viewers to know about recovery?
I think we have to understand what recovery actually is. When we're talking about recovery, it just does not mean a person living free of drugs or clean of drugs, as that is the terminology which is used within the criminal justice system and even within the clinical systems right now. Recovery is a process through which the patients are able to lead their self-directed, productive lives. So we have to see that the recovery pathway for different patients would be different. Some might enter that pathway through abstinence and 12 steps recovery program, while others might need the MAT to support them. And when we're talking about MAT and recovery, we have to realize that the aim of that MAT should not be to wean them off of MAT. The aim should be to help the patient live a productive and self-directed life, which may require the patient to be prescribed MAT throughout the lifetime. So that is also very important that we need to know. And then there are other factors which need to be considered when we're talking about recovery. For example, in Charmin's story, employment is an important factor that needs to come into play. These people, these patients, they need a stable environment, they need stable employment, they need stable housing, and all of that support which is needed for them to remain on the pathway to recovery and remain on the pathway of that productive and self-directed life.
Are there any last thoughts you want to share with our viewers before we close out our Overdose Awareness Day?
I think the last, for the Overdose Awareness Day, I would like to share is that we have lost just too many lives as a result of overdose, and it's time that we need to break that stigma that comes with not only the disease but also the treatment, and we try to help these patients by getting them into the treatment. And we also should always carry Narcan with us, so that because the loved ones are, or the people who are around these patients who are suffering from opioid use disorder specifically, are the first responders. They're the first people to be at the scene. So if we're able to revive these people when they overdose, I think that is the first step of getting them closer into treatment.
You know, what I've always heard people say is someone that's living has the ability for treatment. Someone who passes, there is no ability for treatment. So we want to make sure every life has the access to treatment when they're ready for that. Well, we want to thank our viewers out there who have watched us live or who may be watching this after the fact. There's several people for an event like today that happens behind the scenes that we want to make sure we thank. I want to thank Tina and Luke, who've been helping to facilitate our chat with us today. Caroline and Micah, who've been helping us run the technical aspects of today. Dr. Anwar for her leadership with the Indiana Rural Health Association on this Overdose Awareness Day. We invite you to join us again September 15th, 22nd, or 29th. More details are on our website. And please remember that if you have any questions, you're not there alone. We want to support and help you in any way that we can, even after this event. So please go out to that link, ask those questions, or go to our website. You can find Dr. Anwar's contact information as well, and you can contact her directly for those questions and the support that you need. With that, we wish you all a happy end to August. Be safe, be healthy, and until next time, good night.
Thank you.